Our behaviors have changed during the COVID-19 pandemic, but how and how much? A first-of-its-kind global survey shows things have changed largely for the worse. The one positive is that healthy eating increased because we ate out less, but we snacked more, got less exercise, went to bed later, slept poorly, and our anxiety levels doubled. Those changes were magnified among obese people. Researchers say this group improved their diets the most, but they also suffered the sharpest declines in mental health and the highest rate of weight gain. In fact, 1/3 of obese people gained weight during the lockdown. As a result, researchers say physicians should modify how they manage patients with obesity in two ways: increase the number of mental health screenings during and after the pandemic, and stay connected to patients through telehealth and remote visits to prevent irreversible health effects from the pandemic. Researchers say this study shows that chronic disease like obesity can affect more than just your physical health. I'm Bill Prasad, your mental health and wellness expert.